from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and we're joined by Dr. Devon Ballard, and he's joining us from Baptist Health to talk about something about Mental Health Awareness Month. May is Mental Health Awareness Month, and something that's associated with mental health awareness is OCD. Dr. Ballard, thanks for taking some time out of your day to join us. Look, we use this phrase in our just general talking sometimes, just general conversations. Oh, someone might be, quote, OCD about something, meaning that they're very particular about it. But this is something that is classified under a mental health disorder, correct?
Correct. It's one of the anxiety syndromes. So a lot of people will have like a generalized anxiety with OCD, but OCD is more common than you think. But some people are just more particular in what they like or want. So it doesn't really interfere with a lot of people's lives at times, but sometimes it can be pretty debilitating and devastating to them personally, in jobs, relationships, etc.
Yeah, we mentioned how, sometimes someone might say, oh, they're OCD about that, meaning they just like it a particular way. But you talk about debilitating. What are we discussing here when it comes to how it can really affect people's lives and be debilitating in a way that doesn't allow them to function normally?
So one of the classic OCD problems that we've seen, especially with COVID, is people that are what I call germaphobes. They're so scared to even touch anything, they'll clean their house 3 to 4 hours a day. They'll clean their food before they touch anything, and they'll have to wash their hands 500 times a day, even if they've washed their hands. So classic OCD is knowing you have to do something, but you don't have to do it, but you've already done it. So for example, I just checked the locks at the house, or I just washed my hands, but I got to do it again. And it's a compulsion and obsession that they have to do it over and over again because they're just not comfortable. So washing the hands and some people have to have, literally I've seen it where in their closet everything's color coordinated and every hanger's 1.3 inches apart from the other hanger. And so they have to, and if it's not, they got to change it. So that's where it's a problem that needs to be addressed, especially if it's interfering with relationships and kids and social functioning. And another classic is agoraphobia, where you don't want to leave your house. That's another anxiety syndrome, but OCD can be debilitating but treatable. So
what are those treatment options available to people?
So there's a lot of meds that are indicated for OCD. The most common classification of meds is the SSRIs, like the Lexapro, Zoloft, Paxil, that kind of class of drug. But some of the SNRIs and other meds can too, and also behavioral, CBT or cognitive behavioral therapy with therapists to help recognize triggers for certain OCD tendencies, phobias. But medicine helps significantly, but people have to take it and come see us to get them feeling better. And a lot of times I just saw somebody a minute ago that I started on medicine. I said, have your spouse come in with you. Because sometimes we'll see them back in the clinic and like, do you feel better? Yes or no? And they're like, no, it hadn't really helped a lot. And the spouse like, never take them off of it. They're like a different person. So having an external close family member to help give information on if something is really working outside of the clinic setting at home is very, very effective and helps us kind of steer which way the best treatment course is.
All right. Well, if you'd like to look at those treatment options, if you know someone in your life that is OCD and you would like them to talk with a professional about it, you can call the great folks at Baptist Health. You can call the Baptist Health Helpline or go to baptist-health.com for more resources. Dr. Ballard, great to see you again. We'll talk with you next time.
Thanks again. Thank you. Appreciate it.